Vaginal rejuvenation is somewhat of an all-encompassing term that has to do with procedures that are used to rejuvenate or make healthier the vaginal lining. Those women that would be best served with vaginal rejuvenation are the ones that perhaps are postpartum, their bodies just went through major changes, things are different in the vaginal area, they just want to have a semblance of their own body back. So, doing treatments inside the vagina with essentially therapy that heats up the tissue and brings collagen deposition will help to bring some of that feeling back. It helps with tightening up the tissue. So if women feel like they have vaginal laxity, it helps to fix that. It can help those women who feel they have decreased lubrication of the vagina. It will actually help bring those cells back that produce the lubrication that helps not only with intercourse, but frankly, you need lubrication to not feel irritated just sitting there. Um, of course, it helps postmenopausal or perimenopausal women. As we age, sadly, we start losing vaginal estrogen. And losing vaginal estrogen really wreaks havoc, not only on our vaginas, but it can actually cause problems with bladder behavior as well, bladder behavior and bladder health. We start to have, of course, vaginal dryness, vaginal irritation, pain with intercourse, decreased pleasurable sensation. And then the bladder, we start to have overactive bladder symptoms where we feel more urgency, more frequency. Our risk of leakage of urine or incontinence, urinary incontinence, starts to go up. Even our risk of urinary tract infections start to go up as we get older and lose the estrogen, the vaginal estrogen. So, what these vaginal rejuvenation procedures do is reverse the clock, really reverse that damage that occurs with perimenopause and menopause. It's really fascinating technology, and here at Isla, we offer several different modalities to help with vaginal rejuvenation. We have something called Forma V, which is where we have a vaginal wand essentially that heats up at the tip of it, and it's about a 30-minute treatment to the inside of the vaginal canal as well as to the outer vulva, heating up these tissues to start that process of collagen deposition. We also have something called Morpheus 8V. I'm sure a lot of you have heard of Morpheus. It's a very popular treatment for tightening of the skin on the face and the body. Well, that same kind of technology is now available for the vaginal canal. Again, there's a vaginal wand that has the Morpheus tip that we get to use inside the vagina. Quick treatment there as well. All these treatments are painless. In addition, we offer treatments or treatment sessions with V-Tone. V-Tone is a device, very small, goes into the vaginal canal, and it's almost like a vaginal TENS unit. It sets off stimulation that causes the pelvic muscles and those vaginal muscles to have contractions, and that way you're building up the muscles in the vagina and the pelvis, which ultimately lead to, again, vaginal tightness. And really importantly, it helps with relieving stress urinary incontinence, which is that leakage that occurs with coughing, sneezing, laughing. And it can also help eliminate the feelings of urinary urgency, urinary frequency, and it too helps with leakage associated with that urge to go. You get the urge to go, don't make it in time, have an accident. It can help with all that. So I'm so excited to be able to offer all of these things to my patients.